Welcome to Pediatric Case Review. Today we are covering Maple Syrup Urine Disease, a comprehensive case-based review designed for general pediatricians. Maple Syrup Urine Disease is a serious autosomal recessive metabolic disorder affecting branched-chain amino acid metabolism. If not recognized and treated promptly in the neonatal period, it leads to devastating neurological injury and death. We will walk through 14 clinical cases covering clinical recognition, the pathognomonic odor, biochemical basis, diagnostic workup, disease phenotypes, management, neurological complications, emergency protocols, liver transplantation, and long-term prognosis. Let us begin. Case 1. A 5-day-old male infant is brought to the emergency department by his parents. He was born full-term via normal vaginal delivery. His temperature is 36.8 degrees Celsius, heart rate 148 beats per minute, respiratory rate 44 per minute, and weight 3.4 kilograms. Over the past 48 hours, he has developed poor feeding, increasing lethargy, and irritability. His mother notes an unusual sweet odor. Newborn screening results are pending. What is the most likely diagnosis? Option A, sepsis. Option B, maple syrup urine disease. Option C, urea cycle disorder. Option D, galactosemia. The correct answer is option B, maple syrup urine disease. In the classic form, which is the most common, infants appear normal at birth. Symptoms typically emerge between days 4 and 7 of life. The early signs are nonspecific and include poor feeding, irritability, and lethargy. The characteristic maple syrup odor appears by the end of the first week. This presentation window between days 4 and 7 is critical to recognize. If untreated, the infant will progress to seizures, coma, and cerebral edema. Sepsis can present similarly but lacks the sweet odor. Urea cycle disorders present with hyperammonemia, and galactosemia presents with jaundice and hepatomegaly after milk exposure. Case 2. A 6-day-old male infant is brought to the clinic. He was born full-term with no complications. His mother reports he has been increasingly lethargic, feeding poorly, and making unusual bicycling movements with his legs. On examination, the physician notices a distinctly sweet, caramel-like odor in the infant's earwax. What is the most likely diagnosis? Option A, isovaleric acidemia. Option B, phenylketonuria. Option C, maple syrup urine disease. Option D, tyrosinemia. The correct answer is option C, maple syrup urine disease. The maple syrup odor is caused by sodalone, which is a metabolite of isoleucine. A critical clinical pearl is that the odor is first detected in cerumen, meaning earwax, before it appears in urine. It later appears in urine after protein intake increases. The odor is typically evident by the end of the first week of life. So remember, always smell the cerumen in a sick neonate, as it may be the earliest clue before the urine odor becomes apparent. Isovaleric acidemia has a sweaty feet odor, not a sweet odor. Phenylketonuria has a musty odor but does not present acutely in neonates. Tyrosinemia does not have a characteristic sweet smell. Case 3. A 5-day-old male presents with poor feeding and lethargy. Newborn screening is positive for elevated branched-chain amino acids. His parents are consanguineous. Genetic counseling is requested. Which multi-enzyme complex is deficient in maple syrup urine disease? Option A, branched-chain alpha-keto acid dehydrogenase complex. Option B, phenylalanine hydroxylase. Option C, galactose 1-phosphate uridyl transferase. Option D, ornithine transcarbamylase. The correct answer is option A, the branched-chain alpha-keto acid dehydrogenase complex. This enzyme complex catalyzes the second step in branched-chain amino acid metabolism, which is the oxidative decarboxylation step. The branched-chain amino acids, leucine, isoleucine, and valine, first undergo transamination to form alpha-keto acids. The branched-chain alpha-keto acid dehydrogenase complex then converts these keto acids into acyl coenzyme A derivatives that enter the citric acid cycle. When this complex is deficient, branched-chain amino acids and their corresponding alpha-keto acids accumulate in plasma and brain. Leucine is the most neurotoxic of the 3 accumulating amino acids. The complex has E1-alpha, E1-beta, E2, and E3 subunits, and requires thiamine as a cofactor. Case 4. A 4-day-old male infant has routine newborn screening return with a flagged result showing elevated leucine and isoleucine on tandem mass spectrometry. Valine is also elevated. The infant appears clinically well at this moment. What is the next best diagnostic step? Option A, repeat newborn screening. Option B, plasma amino acid analysis. Option C, urine ketones. Option D, magnetic resonance imaging of the brain. The correct answer is option B, quantitative plasma amino acid analysis. This test detects elevated leucine, isoleucine, and valine. Leucine levels in maple syrup urine disease are typically above 235 micromoles per liter and often above 380. Isoleucine rises above 150 and valine above 212 micromoles per liter. Critically, alloisoleucine elevation is pathognomonic for maple syrup urine disease. A level above 5 micromoles per liter confirms the diagnosis, as alloisoleucine is normally not detectable in human plasma. The diagnostic pathway proceeds from positive newborn screening to plasma amino acid analysis, then genetic testing for branched-chain alpha-keto acid dehydrogenase mutations and urine organic acids with the dinitrophenylhydrazine test. Case 5. A 5-day-old male infant with suspected maple syrup urine disease undergoes plasma amino acid analysis. The newborn screening had flagged elevated branched-chain amino acids. The laboratory reports detection of an unusual stereoisomer not normally present in human plasma. Which specific metabolite detected on plasma amino acid analysis is pathognomonic for maple syrup urine disease? Option A, leucine. Option B, isoleucine. Option C, valine. Option D, alloisoleucine. The correct answer is option D, alloisoleucine. Alloisoleucine is a stereoisomer of isoleucine that is unique to maple syrup urine disease metabolism. Levels above 5 micromoles per liter in plasma are pathognomonic, meaning this finding is not seen in any other condition. Standard tandem mass spectrometry screening cannot distinguish leucine from isoleucine, so alloisoleucine testing through quantitative plasma amino acid analysis is the confirmatory step. If alloisoleucine is detected, maple syrup urine disease is confirmed. If it is not detected, consider other diagnoses such as hydroxyproline. No other diagnosis produces this metabolite. Case 6. A 2-year-old boy is brought to the clinic during a viral illness. His mother reports he has been unusually wobbly when walking and extremely lethargic for the past 24 hours. He was previously meeting all developmental milestones normally. No prior metabolic workup has been performed. What is the most likely diagnosis? Option A, intermittent maple syrup urine disease. Option B, classic maple syrup urine disease. Option C, intermediate maple syrup urine disease. Option D, thiamine-responsive maple syrup urine disease. The correct answer is option A, intermittent maple syrup urine disease. This variant has residual branched-chain alpha-keto acid dehydrogenase activity of approximately 5 to 20%. Children show normal growth and development between crises and can tolerate a normal diet when well. However, acute encephalopathy is triggered by metabolic stress such as febrile illness, prolonged fasting, surgery, trauma, or high protein intake. Branched-chain amino acids are elevated only during crises. The onset is typically in childhood or later. Classic maple syrup urine disease presents in the first week of life with less than 2% enzyme activity. Intermediate maple syrup urine disease shows persistent developmental delay. Thiamine-responsive maple syrup urine disease responds to vitamin B1 supplementation. Case 7. A 4-day-old male neonate presents with poor feeding, progressive lethargy, and a sweet odor in his cerumen. Newborn screening returns positive for elevated leucine levels. He is now admitted to the neonatal intensive care unit for urgent evaluation and management. What is the most appropriate immediate dietary intervention? Option A, low-protein diet. Option B, soy formula. Option C, branched-chain amino acid-free medical formula. Option D, high-calorie diet. The correct answer is option C, branched-chain amino acid-free medical formula. This must be initiated immediately, and you should not wait for confirmatory testing. Lifelong dietary branched-chain amino acid restriction is the cornerstone of management. High branch-chain amino acid foods such as meat, dairy, eggs, and legumes must be avoided. The branch-chain amino acid-free medical formula provides essential amino acids minus leucine, isoleucine, and valine. Low branch-chain amino acid foods such as fruits, vegetables, fats, and carbohydrates are allowed. Leucine tolerance must be monitored and adjusted regularly. A sick day protocol is essential during any illness or stress. Case 8. A 5-day-old male neonate, born full term, was diagnosed with maple syrup urine disease via newborn screening. Despite initiating dietary management, he develops worsening lethargy, high-pitched cry, a bulging anterior fontanelle, and an episode of apnea requiring bag mask ventilation. What is the most likely cause of his acute neurological deterioration? Option A, hypoglycemia. Option B, meningitis. Option C, intraventricular hemorrhage. Option D, cerebral edema. The correct answer is option D, cerebral edema. Leucine toxicity causes life-threatening cerebral edema through cytotoxic mechanisms. Elevated plasma leucine accumulates in brain tissue, leading to cell volume dysregulation with decreased osmolarity and decreased sodium. This results in cytotoxic edema with increased intracranial pressure and brainstem compression. On magnetic resonance imaging, diffusion-weighted imaging shows symmetric hyperintensity predominantly in the brainstem and cerebellum. These are the areas most affected in maple syrup urine disease. This is a medical emergency requiring immediate intervention to reduce leucine levels. Case 9. A 5-day-old term neonate presents with progressive lethargy, poor feeding, and abnormal posturing. Newborn screening reveals markedly elevated branch-chain amino acids. The metabolic team confirms maple syrup urine disease. The attending asks the intern, which accumulated amino acid is the primary driver of cerebral edema and brain injury in this condition. Option A, valine. Option B, isoleucine. Option C, leucine. Option D, alloisoleucine. The correct answer is option C, leucine. High leucine competes with essential amino acids for brain entry via the large neutral amino acid transporter type 1. This depletes phenylalanine, tryptophan, and glutamine in the brain. As a result, neurotransmitter synthesis is impaired, specifically serotonin, dopamine, and gamma-aminobutyric acid production decreases. Leucine also disrupts cell volume regulation, leading to cytotoxic cerebral edema. The key concept is that leucine toxicity essentially creates amino acid starvation of the developing brain. While all 3 branch-chain amino acids accumulate, leucine is by far the most neurotoxic and is the primary treatment target. Case 10. A 5-day-old male infant, born full term, presents with progressive neurological deterioration. On examination, he displays extreme arching of the back with rigid extension of the neck and limbs. His tone is markedly increased. Newborn screening was flagged for elevated branch-chain amino acids. What is the term for this abnormal posturing? Option A, opisthotonous. Option B, decorticate posturing. Option C, normal newborn reflex. Option D, simple hyperextension response. The correct answer is option A, opisthotonous. Opisthotonous is defined as extreme backward arching of the head, neck, and spine. It is caused by toxic leucine accumulation in the central nervous system. This finding indicates severe neurological compromise and requires urgent action. It correlates with brainstem and cerebellar cytotoxic edema on magnetic resonance imaging. Opisthotonous typically appears in the first week of life in classic maple syrup urine disease. Other neurological red flags include seizures, hypertonia, apnea episodes, altered consciousness, and abnormal reflexes. Diffusion-weighted magnetic resonance imaging shows symmetric hyperintensity in the brainstem, cerebellar white matter, and deep white matter. Case 11. A 14-month-old boy with known maple syrup urine disease presents with fever at 38.9 degrees Celsius and vomiting for 12 hours. He is refusing feeds. His last plasma leucine was 180 micromoles per liter, now pending repeat. He appears lethargic and irritable. What is the priority management step? Option A, admit for intravenous glucose and insulin. Option B, oral thiamine supplementation. Option C, low-fat diet initiation. Option D, empirical antibiotics. The correct answer is option A. Admit for intravenous glucose and insulin. High glucose infusion suppresses protein catabolism. The glucose infusion rate should be 10 to 12 milligrams per kilogram per minute. All natural protein intake must be stopped immediately to eliminate branched-chain amino acid intake. Branched-chain amino acid-free formula should be continued to maintain caloric support. Frequent leucine monitoring every 4 to 6 hours is essential during crisis. If leucine levels exceed 380 micromoles per liter, this is a metabolic emergency and dialysis or intensive care unit admission should be considered. Natural protein is reintroduced only when leucine levels normalize. Remember, a leucine level above 380 micromoles per liter means act immediately. Case 12. A 3-year-old boy presents with mild developmental delay and occasional episodes of ataxia and encephalopathy during febrile illness. Plasma amino acid analysis shows mildly elevated leucine and isoleucine levels. His pediatrician initiates high-dose vitamin B1, also known as thiamine, supplementation. Over the following weeks, his amino acid levels normalize significantly and his episodes decrease in frequency. This clinical response to thiamine supplementation is most consistent with which maple syrup urine disease phenotype? Option A, classic maple syrup urine disease. Option B, intermittent maple syrup urine disease. Option C, intermediate maple syrup urine disease. Option D, thiamine-responsive maple syrup urine disease. The correct answer is option D, thiamine-responsive maple syrup urine disease. The branched-chain alpha-ketoacid dehydrogenase complex requires thiamine pyrophosphate as an essential cofactor. In this variant, high-dose vitamin B1 partially restores enzyme activity. The phenotype is milder with later onset and less severe symptoms. E1 alpha subunit mutations are the most common mutations that respond to thiamine. Residual enzyme activity ranges from 3 to 30% of normal. This is a critically important clinical pearl. Always trial high-dose thiamine in suspected maple syrup urine disease because it is safe and may be life-changing for the patient. Case 13. A 4-year-old boy with classic maple syrup urine disease has been on a strict branched-chain amino acid-restricted diet since birth. Despite careful dietary adherence, he experiences recurrent metabolic crises with encephalopathy, multiple hospitalizations, and significant impact on family quality of life. His parents ask about a more definitive treatment option, which intervention can offer a metabolic cure and potentially eliminate the need for strict dietary restriction. Option A, splenectomy. Option B, bone marrow transplant. Option C, liver transplantation. Option D, gastrostomy. The correct answer is option C, liver transplantation. The transplanted liver provides sufficient branched-chain alpha-ketoacid dehydrogenase activity to normalize branched-chain amino acid levels. The liver contributes 9 to 13% of total body enzyme activity, which is sufficient to normalize metabolism. After transplant, patients no longer need strict dietary restriction. It prevents further neurological damage but does not reverse existing deficits. Graft survival is excellent, with 100% at 1 year in reported series. Pre-transplant median leucine levels of 713 micromoles per liter decreased to 164 micromoles per liter at 1 year post-transplant, representing a 77% reduction. Transplant is indicated when dietary control fails or quality of life is severely impaired. Case 14. A 4-year-old boy was diagnosed with classic maple syrup urine disease on newborn screening and started on dietary therapy within 72 hours of birth. His leucine levels were unstable during the first year, with several peaks above 400 micromoles per liter during febrile illnesses. Now his parents ask about his expected neurocognitive development. What is the primary determinant of neurocognitive outcome in a child with maple syrup urine disease? Option A, birth weight. Option B, gender. Option C, serum glucose level. Option D, severity and duration of leucine peaks. The correct answer is option D, severity and duration of leucine peaks. Children diagnosed before day 7 of life and treated promptly have the best neurodevelopmental outcomes, with mean developmental scores in the normal range. Those diagnosed after day 14 or with poor leucine control show significantly lower scores. The key predictors of good outcomes include diagnosis before day 7 of life, stable leucine levels between 100 and 200 micromoles per liter, lifelong dietary adherence, and minimizing the severity and duration of cerebral edema episodes. With early diagnosis and consistent management, most patients can achieve normal schooling and independent adult life. Pre-existing neurological damage is not reversed by treatment, so prevention is the only cure. Before we wrap up, I want to tell you about our community on Patreon called Pediatric Case Review. In this community, you will find all our videos systematically organized by body system, so you can quickly access any lecture you need. All presentations used in the videos are available as downloadable images, so you can study offline at your convenience. We also have comprehensive case studies to sharpen your diagnostic skills. For details on how to subscribe, comment below in this post, and we will message you directly. Let us now review the 5 key clinical pearls from today's lecture. Pearl 1. Screen early. Newborn screening prevents irreversible neurological damage. Pearl 2. Leucine is toxic. Elevated leucine causes cerebral edema and neurological crisis. Pearl 3. Lifelong diet. Branch-chain amino acid-restricted diet is the cornerstone of metabolic control. Pearl 4. Transplant cures. Liver transplantation normalizes branch-chain amino acid metabolism and frees patients from strict dietary restriction. Pearl 5. Monitor closely. Regular amino acid levels and sick day protocols prevent crises. Follow Pediatric Case Review for more case-based clinical lectures and comment your questions below. Thank you for joining this Pediatric Case Review lecture on Maple Syrup Urine Disease. I hope you found this case-based review informative and useful for your clinical practice. Please remember that these lectures are for educational purposes only and do not constitute medical advice. Always consult current guidelines and specialists for clinical decisions. If you have any questions, please comment below. Follow Pediatric Case Review for more case-based clinical lectures. See you in the next one.